say that, well, I had a press conference yesterday, and Dr. Dillon, I said that I would probably be announcing the case very soon. I didn't know it was to be today. So we're here to announce our first presumptive positive case of novel coronavirus that we were just made aware of earlier today. And I'd like to say that in this process, you're going to hear from various representatives at the table here, including from the minister. And as I said yesterday, the system we would hope would work as it is, and it did. Right through the whole process, you're going to hear evidence that people did what they're supposed to do. They're carrying out what they are doing, and they're going to follow up on that. As a result, the risk to Ontarians is still low, and things are managed and well controlled, and as I hoped, the system is operating as it should. So with that, we have a test that was from our lab that was confirmed presumptive positive, just in the name of the terminology, while we can do the lab test, and we have people here from introduce themselves in a moment as we go through the table. And you'll hear from different the laboratory in that, of how we've undertaken this. And we're working this in conjunction with our partners at Public Health Agency of Canada to keep them notified and aware of what we're doing, and to coordinate according to our standards and protocols throughout the country. And of course, with our partners in the international field as well. So with that, I'm going to ask Dr. Barbara Yaffe to give some, she's an Associate Chief Medical Officer of Health to my left, and she will give us more details on the actual case that we're speaking of. And so I'm going to hand the microphone over to her, to Dr. Yaffe.
Thanks very much, Dr. Williams. So the case is in a male who's in his 50s. He had traveled to Wuhan, China, and come back, and within a day became quite ill. And the emergency service was aware of his travel history, used full precautions, was taken to Sunnybrook Hospital, and is now in a negative pressure room. All the staff are taking appropriate precautions, and the condition is stable. I'm sure you'll hear more about that if you wish from Sunnybrook physicians who are here. So we were notified of the lab result today, in the middle of the day, and we have notified Dr. Teresa Tam, the Chief Public Health Official at Public Health Agency of Canada. We have had conversations with Toronto Public Health, Public Health Ontario, the hospital, and with Public Health Agency of Canada, and we're working in very good collaboration and cooperation to ensure that everything is done to not only manage the case but prevent any spread. And you'll be hearing more about that from my colleague on my right, Dr. Eileen Davila, who will tell you about Toronto Public Health's role.
So thank you very much. Thank you, Dr. Williams and Dr. Yaffe, for that introduction. And by way of introduction for myself, I'm Dr. Eileen Davila, Medical Officer of Health for the City of Toronto. So as you've just heard from my colleagues, we have the first presumptive case confirmed of this novel coronavirus here in our city. We at Toronto Public Health, as you just heard, learned about this case earlier this afternoon. And as I've indicated in the past, there is a public health system. Following up on cases of infectious disease is exactly what we do in public health each and every day. So in this particular case, once we were notified of the presumptive confirmed case of coronavirus, we started our actions in terms of public health. And as I've mentioned before to members of the press and through public communications, what this looks like is understanding where the case was, what the circumstances were under which the person became ill. And our focus then also is on making sure that we understand who might have been exposed to this individual and in what sorts of settings the individual has been, so that we can determine who else might have been exposed and who might be at risk for further illness. But again, this is something that we do on a regular basis in public health, and this is in fact what my staff are actively doing now, having heard of this particular situation earlier this afternoon. As I've promised to the public, as more details emerge and as we have more information to provide, we will continue to keep you informed on what the situation is and continue to provide you with advice on what the situation is here in our city. I would like to say that we do appreciate very much the collaboration from our partners. We did hear from them very quickly, and that allowed us, as the local public health department, to get on the case and to start our work as early as possible.
I'm going to hand the microphone over to Minister Elliott.
Thank you very much, and good evening, everyone. I'd really like to thank Drs. Williams, Yaffee, and Davila for your thorough and comprehensive review of the steps that Ontario and Toronto are taking together to contain this case of the Wuhan novel coronavirus and protect the health of the public. Working directly alongside our partners at the Public Health Agency of Canada and local public health units across the province, we have been actively monitoring to quickly detect and contain any cases of the Wuhan novel coronavirus. I want to assure all Ontarians that this is exactly what transpired. The system is working. These protocols and procedures have been in place for some time. The patient was detected and immediately put in isolation. Lab tests were conducted, and at the earliest signs of a presumptive positive case, Toronto Public Health launched extensive case and contact management to prevent and control further spread of the infection. To be clear, health officials are actively working to ensure that we identify everyone this person was in contact with in order to contain this virus. Ontarians can rest assured that the province's integrated healthcare system today is far more prepared to respond to any potential health risks than in the past. All Ontarians should take comfort in knowing that our public health officials and skilled healthcare providers are bringing their considerable knowledge, skills, and experience to respond to this emerging situation. To help educate Ontarians about the Wuhan novel coronavirus, how they can protect themselves, and what they can do if they suspect they may be at risk, the province has launched a new dedicated website, ontario.ca/coronavirus. Each weekday, this webpage will be updated with the most up-to-date information on the number of cases under investigation and those that have been confirmed. I have no doubt that increased information will help Ontarians protect themselves as this issue emerges. As it does, we will continue to diligently monitor this issue to ensure that Ontario remains prepared to identify, contain, and treat any additional cases of this virus. Our top priority will always remain safeguarding patients, the public, and providers. The changes announced today and the steps that are being taken today support our commitment to protecting Ontarians. So thank you very much, and we would be pleased to take any questions that you may have.
What exactly did this person identify himself as feeling ill?
I'm sorry, can you hear the rest of the question?
Sorry, when exactly did this patient identify himself as feeling ill? When did he travel back? When was his flight?
The data we have is that the individual flew out of location, there's no direct flights from Wuhan. There was another flight into Toronto on the 21st of January and arrived in Toronto on the 22nd and then felt ill and had asked a family member to contact 911, and they told them totally about the situation. So ambulance services went fully protected, and that's the way we like them notified, and it was taken to Sunnybrook Hospital.
Janice Olin, CBC News again. Can you just tell us, has his family been put in quarantine? What kind of measures are you taking with those who've been in direct contact?
So as mentioned earlier, when we get notified of a case, we begin the entire process of what we call in public health case and contact management. So in this case, as you've heard with this individual in question, it was patently clear that there were symptoms of a respiratory illness and that there was a relevant travel history. So I think it's important here to note that this individual has been handled from start to current, at the current time, from the start of the interaction with the healthcare system, with all appropriate precautions and protections in place.
Okay,
As a
but-
result of that, I'm going to continue on. As a result, along with that, we are actively following in respect of contacts. It's a relatively small family situation here. We feel that we've got this well managed at this point in the game. We know who the contacts are that are closest, making sure that they're aware of what they should be doing should they find themselves in a situation that requires medical attention.
How can you be sure? How can you be sure exactly how many people he's been in contact with? We don't know what part of the city he's in. We don't know if he's been to a school, a community center, a mall. What can you tell us about this individual, where they are, and where they have been?
So what I can tell you right now is that our staff are actively doing their contact tracing and follow-up activities as they do with every single communicable disease case. So that is exactly the job of public health. And at this stage of the game, my staff are working on it right now. Contact has been, the last word I heard was that there was very little by way of contact, but we are absolutely making sure that we get the history of all the places the individual has been. That's part of regular public health practice, in order that we can then determine who needs to be informed and what sorts of measures they need to take.
Today's the 25th, though, and he arrived on the 22nd. That is a widespread range of time, and a lot of people can be in contact. How do you contact everyone that's been through Pearson Airport in that time? What part of the city are we talking about? Where was this person?
Okay, just to add to what Dr. Davila said, first, I think we have to keep the context here that the evidence to date is that this is not easily transmitted between people. It's generally people who traveled, they acquired it in Wuhan, or other people who had been in Wuhan, but in terms of transmission, it's mostly to very close household contacts. And I can assure you that any close household contacts have already been put into self-isolation and are being monitored. And it's a very small number of people. This individual came to Toronto on the 22nd and was in hospital on the 23rd. So, I mean, Toronto Public Health is again re-interviewing the individual. But our knowledge is that he really wasn't in Toronto very long. He wasn't feeling well. I think he was at home, and the people who live with him are in self-isolation.
Can you identify the flight he was on? Can you identify the flight he was on? Was it from Hong Kong? Was it from Beijing? Where is it from?
Canada, and how significant is that?
We had discussion with the Public Health Agency of Canada, and this is the first presumptive confirmed case. As I said before, their protocol is that our tests, and we have Dr. Donnelly here from the agency as well, that our tests, while we're convinced they do demonstrate positivity, there's confirmation of the National Medical Laboratory in Winnipeg, and once that's done, then it is a fully confirmed case. We're pretty well 95% sure it is, and there's no other cases yet, so this would be, as far as Dr. Teresa Tam is concerned, the first case reported in Canada, presumed positive.
Given he was so sick the day after he landed, one would assume he would have been contagious on the plane. Can you tell us what flight he was on, where he was coming from?
Are we expected to see more?
I would not be surprised. As I said at the press conference yesterday, we're waiting for our first case, and I would think with the amount of flow and traffic and stuff, we may see some others. And so this doesn't mean we sit back. We get more vigilant in our approach and monitoring with our full system. So I would be very surprised if this is our last case, but we have to wait to see.
What flight was he on the 22nd? Can you tell us that? Was it from Hong Kong? Was it from Beijing? Where was it?
I think we have to wait until we get confirmation through Toronto Public Health with all the details, respecting some of the investigation at this time. And we are discussing things with authorities just to make sure we're fully up to speed on all those details.
Because the transmission period, obviously they said it can take up to 2 weeks, 2 days to 2 weeks for someone to get sick. So obviously he would have been contagious while he was on the plane. So don't you think the people who were on the plane with him should know?
Let me correct that. The information we received that people, if they're asymptomatic, are deemed not to be. Once you develop symptoms, you can be contagious. They believe up to a 2-week period.
So can you just clarify then, do we know whether the individual had symptoms on the plane?
Yeah.
And therefore, what's the degree of risk to people who were on the plane with him?
We're reassessing that situation. Our original understanding is that originally what we heard, and it was a language issue, is that not fully symptomatic, but we have to get some clarification to see is there any further things we have to do. So we want to make sure we're comprehensive and precautionary in our approach to the matter. So that's still being undertaken with Toronto Public Health.
On the timeline, could you clarify when he was last in Wuhan?
We don't know that per se. It would have been in the 14-day period that we have for our travel advisor in there. That he, of course, there was no direct flight from Wuhan into Toronto. So transit time, that we're going to get those details as they become clear time. But we're convinced it's within the quarantine or the period of concern, having gotten someone else perhaps, and so therefore he would fit the travel definition, have a case.
So, but we're talking about someone who was left China on the 21st, arrived in Canada on the 22nd, was in hospital on the 23rd, and was on a plane with hundreds of people that also arrived in Toronto on that day. What else can you tell us about his travels once inside Canada, or the people that were on that plane? Have you been able to contact them in this time, or are you just starting that process now?
Well, I'll have Dr. Hill add some more details, but the process is one that's has undertaken, it's ongoing, and it does take time to be thorough because you want to make sure you have all the details correct. I'll let Dr. Davila add a few comments.
Absolutely. So I appreciate your question. As you've just heard, though, we got lab confirmation or presumptive laboratory confirmation earlier this afternoon. We are now in the process, as the local public health unit, of undertaking the investigations, understanding the history of the ill individual, and all the activities that that individual has undertaken since becoming ill. At this stage of the game, I have very early information. My staff have been working on it this afternoon, and I anticipate that as I have an opportunity to go back and speak with them, we'll have further details. But we wanted to make sure that you had information at this point. What my understanding is at this point, though, is that we have somebody who's had very little external contact, not much by way of activity, and we're going to continue our investigation at this stage. But I certainly appreciate where you're coming from. This is exactly the reason why we continue to do these. This is exactly the reason why we do this investigation. We do need to assess the flight and assess what the entire history of the patient is, so that we can make appropriate measures and take appropriate action.
Diagnostic TV News Network, Dr. David Heyman with the World Health Organization says that there's new evidence one can catch the coronavirus from someone who just sneezes near you. At first you thought it was only transmitted through close contact, like hugging, kissing, or sharing utensils. As you said, people who are in close proximity. But if someone's sneezing on a plane and it's recirculated air, what danger are the people who are on that plane facing? And we'd also like to know what plane this was. There were a large number of media that were questioning people coming on flights from China and Hong Kong on Wednesday, so we'd like to know what flight this was. I think that's a fair question to ask. What flight was this?
So if I could just add, I think those are all very good questions, and certainly people are concerned. With respiratory infections, if this person was symptomatic and infectious during the flights, and that is something we're still ascertaining, the protocol is to work with the federal government, and I have talked to Dr. Teresa Tam at the Public Health Agency about this already, getting the flight information up to them through to get to the manifest, and usually to identify people who are within 3 rows of the person who's infectious, because they would be at risk potentially. We've just found out about this afternoon. We do have some preliminary information, but we don't have enough information yet to share.
Can you tell us what city they came from? I mean, it seems odd that you wouldn't be able to tell us much. It seems like you're actually holding back information.
Well,
I know it's all new to you as well, but you're talking about a flight with hundreds of people arriving in Toronto with a virus that is killing people. You understand why people will be apprehensive.
What we do know is he took a flight from Wuhan to Guangzhou, Guangzhou to Toronto. The details are still forthcoming.
So what is your message to the public at this
would certainly encourage people to check the website that has just been established, ontario.ca/coronavirus. That will contain information about the symptoms that may be indicative of the coronavirus. And we encourage people to come forward. People are this person in question self-identified and came forward. And we also encourage people to take normal precautions, making sure you wash your hands often, coughing into your elbow, just all the normal things that you should do to prevent transmission of any kind of virus. But the other message that I would like to give to all Ontarians is that we are working all systems of government, municipal, provincial, and federal. We are all working together. We are all communicating. I have had a call, yesterday I had a call with provincial and territorial ministers, with Minister Haidu. I just spoke with her again. We are collaborating, we are working in cooperation, and we are doing everything that we can at the various levels responsible to make sure that we protect all Ontarians and all Canadians.
Have you had any other people self-reporting who are on that same flight, whether it be with symptoms or just, informing you that they're on a flight and they are having concerns?
No, we've had no reports. We are continuing to get people under investigation in that, and we're getting tested, and all so far all ruled out except for this one case.
And you can't, I know you said you were retracing steps, but you aren't able to say how the patient got from the airport to his home, whether it was public transit, in a personal car, in a taxi, anything like that?
All to be determined and finalized.
Dr. Smith, can you just expand on how Sunnybrook has handled the case, how the patient is doing, how many staff have been in touch with this patient?
I'm going to answer your question sort of in the general. I'll make a couple of points, and then I'm going to pass to my colleague, Dr. Leese, who's the expert, who's the head of our infection prevention and control department at Sunnybrook. But what I want to echo the messages that my colleagues have brought forward. But in addition to say, obviously, at the hospital level, our job is to make sure we take the best care of the patient, and we're doing that presently. It's also to make sure that we continue to be prepared to take care of the populace of the city and beyond, together with our partners. And it's been stated, but let me emphasize, the degree to which we have learned from past events such as SARS, for example, is tremendous. So the degree to which we see an increase in the sophistication with how infection prevention and control measures are taken both in the emergency department, indeed even before, for example, with our paramedic colleagues, and then into the hospital. I'm very, very pleased and proud to see how that's worked extremely smoothly, and we need to, together with our partners across the health system, who are already, as you heard the minister say, increasingly integrated and connected. We are certainly will be working together on that. And the third point I want to make before I pass to my colleague, Dr. Leese, is in all of this underscore just how important it is to take care of the patient and the populace, but also our healthcare teams. So certainly at the top of my mind is making absolutely certain that we are empowering and making sure that our healthcare teams, which are so critical to be able to not only take care of patients but be protected themselves, are done. So those are the three things that are top of mind for me, and maybe I'll pass the microphone to my colleague and he can give a little bit of sort of more general information about care of the patient.
Thank you. So Dr. Jerome Leese, Medical Director for Infection Prevention Control at Sunnybrook. When the patient arrived to Sunnybrook, they were actually immediately identified as being a patient that should be a person under investigation for this particular virus. At Sunnybrook, just like at other hospitals across Canada, we have established infection prevention control protocols, and so it's just our usual practice to screen all patients on arrival for the presence of any respiratory symptoms or fever. And so this particular patient was immediately identified, and we had the travel history immediately as collected by the emergency services, and they were immediately placed into the appropriate precautions on arrival.
What are appropriate precautions?
So we've instituted the appropriate precautions for in acute care hospitals as recommended by public health, as well as provincial guidance as well, which includes the use of personal protective equipment and a negative pressure room for air circulation, and that's where we've been caring for this patient since their arrival.
Do
Can you talk to us about the proportion of patients who are infected with this that die, to the best of your knowledge, and what the transmissibility of this is?
So I first want to emphasize that we are still learning about this particular virus, and so some of those questions are difficult to answer at this time. I can tell you that from the literature that is rapidly coming out in terms of this virus, and we've learned an incredible amount in the past month, in the healthcare settings where healthcare workers have managed these cases, the risk of death has been in the range of around 10%. But I think we need to be careful with those numbers because in Canada, we have established protocols. Many of those cases may have been in a situation where they didn't actually know the virus. They may not have recognized the infection. In this specific instance, we identified that they might be at risk immediately and have placed them into the appropriate precautions. We're providing supportive management, and currently the patient is stable.
In terms of the issue of, sorry, go ahead, I lost my train.
What about the paramedics that treated this individual? Have they been placed in self-incubation or are there any extra precautions that they've done? And was this individual taken directly from their home to Sunnybrook or was there a hospital transfer?
I'm going to make an initial comment, and Dr. Davila may want to amplify this, but in preparation or as we were walking in, and of course, as you've heard repeatedly, this has taken place in the last few hours. But of course, we've begun talking with our partners leading up to this conference right now. So it was very reassuring to hear when speaking to the head of Toronto Paramedic Services, just to reconfirm that from the moment they were alerted to the nature of the patient they're picking up, the paramedics, who are the very first responders, took all the same type of high-level precautions, the type of things that we've learned and are so much better than we were 17 years ago. So right from that first contact with the healthcare system, which is through the paramedics, right through to the handoff, if you will, within the Sunnybrook Emergency Department, best practices have been followed, and I was pleased to be able to speak to the head of Toronto Paramedic Services before coming in to, obviously they're critical partners, and this is something we're going to check and recheck, and I know that public health has also spoken with them.
Yeah, that's right. I'll confirm what Dr. Smith has just said. You know, we are still in the early hours of having learned of this particular situation. However, I have also had the opportunity to confirm with our paramedics partners that all the appropriate precautions were used as they transported the patient to hospital, and it was a direct transport. I think that is very much, again, one of the earliest stages in the investigation. That's why we're able to speak to that point. We are continuing our investigative work and expect that we will have greater updates as our staff have more time to investigate and do the work that they do on a daily basis.
So are these paramedics quarantined or self-incubated at this time?
Know that you know, given that they were using full precautions, it's for them absolutely regular business.
What about the airport? Should we be stopping travel from areas with high concentration of infections, or at least screening when people arrive in Canada?
As we announced before, the Public Health Agency of Canada has instituted information material at the airport this past week. They've updated their kiosks with questions and questionnaires. They've trained their borderline security officers as well as their quarantine officers to ask those questions and to ascertain if anyone has symptoms coming off flights from anywhere in China into Toronto, Vancouver, and Montreal as well. And if they answer any of those questions, they're, in respecting privacy, interviewed and asked questions, and if need be, will be referred to one of our local hospitals out there, which we've already had consultation with, as well as with Peel Public Health. So we have that all set in place to screen those passengers come in from anywhere in China, as well as some flight crew information, say there's a client or patient, passenger, who was not well on the flight, they would report that. You have to remember, in China, the government has stopped all movement in and out of the Hubei province, which is known as Wuhan, but the surrounding ones of a 20 million population, limited all transport in and out. So these are fairly stringent steps undertaken by the Chinese government. They have been screening anyone getting on flights, leaving Wuhan and traveling that for the week prior. So they are taking various sort of measures to limit that as best they can. People are asymptomatic, and they can have it when they arrive here. But as we've seen with a lot of ones we've investigated so far, they seem to have a number of other respiratory viruses that are circulating here in Ontario. But I think the point we're saying with this individual, what I understand is they have a residence here, just the person and their partner, at least we understand, wife, went home because they're not well, and then had someone contact 911, and they had seemed to have very limited, but we'd like to make sure we're convinced of that. And so that's where Toronto Public Health with translation help and assistance, and we understand the person's wife is asymptomatic. So a very limited exposure at all, but we want to make sure we're convinced of that.
This might sound silly, but you talked about figure out where this man has been. How do you go about doing that, especially if there's something like a language barrier? That could be for public health or whoever is.
Sorry, could you repeat that question?
Like I said, it might sound silly, but you're going through the process now to figure out where this man had been between the airport and his home, and if there's been any other broader contact. How is it you go about systematically doing that?
I'm going to hand you back to Dr. De Villa to answer that. I'm Peter Donnelly from Public Health Ontario, President and Chief Executive. I just want to explain something that my colleague said, just because it's very important we're not misinterpreted. My colleague was asked about the case fatality rate, and he gave a figure of 10%, talking about people who were acutely ill, the most ill people in hospital. I think it's very important for us all to realize that many people will have a very mild form of this disease. Many people in China probably don't even know they've had it, haven't sought medical care, or if they have sought medical care, have recovered quite quickly. This is fairly typical of a viral disease. So I wouldn't like you to misinterpret my colleague and leave here thinking that 10% of everybody who contract this disease will die, because that's not the case. We do not believe that that's the case. Yeah, absolutely. He was giving a figure about a very specific thing, and I think it's just important that we're clear about that. The other thing, just before handing you back to Dr. De Villa, which I think it's very important for us to realize, we are in a very, very different place than we were when we were responding to SARS 15, 17 years ago. And one of the things that's very different is that we know what the virus is, we have a fast, reliable test for it, and that really is a game changer, because it means that you can very quickly find out whether people have this or not. You can follow up their contacts where it's appropriate, you can test them, and these are the tools that you need in order to control this and to stop its spread. Now, to answer your specific question, I'm going to hand back to Dr. De Villa.
So the question was with respect to how we investigate, how we find out. And in fact, it is through talking with the ill individual and those who are in close contact with that ill individual, often family members, people who were with them, to understand what the history is. It's as simple as that. It's conversation, and it's a very thorough assessment process to understand, now that we know what the disease is, what are the relevant time features, what's the time period that we're looking at, and we go carefully over the history with the individual and those in their close immediate family to understand what they, where they've been, who they might have been with, and what different settings are, so we can then determine who next do we need to follow up with. And this is standard practice within the realm of public health.
And can you not tell us which area of the city this was in, broadly speaking, and why not?
So at this stage of the game, again, I'm not doing the direct investigation. I've learned of this myself just very recently this afternoon. I know that my staff are out there investigating this right now. They are following up so that we actually do have the information. So I'm very happy to share information with you once I'm aware of it.
But at this point, you can't say he left the hospital or the airport, and so you're investigating those 3 rows. You can't say, did he get into a cab? Did he get on the UP Express? Did he get on a bus or a subway?
So
You
my
can't tell us
understanding.
any of that.
My understanding at this stage of the game is that it was private transportation, so not mass transportation, from the airport to home, and subsequently home to hospital through the route through paramedics, just as you've heard.
Will you be
But that's as far as I know. I don't have further details
Is this
beyond
individual
that.
Canadian?
Again, I don't have details on that yet.
Will you be publicizing the passenger list of the aircraft?
I'm sorry.
Will you be
no.
publicizing the passenger list of the aircraft that the gentleman flew in on?
I think Dr. Yaffe may make some comments, but our process is one to work with federal authorities and to ascertain more details from public health interviewing the individual, were they ill or not at all on the flight. I understand the person became symptomatic quite a bit after arriving in Canada. And then there's protocols, as Dr. Yaffe's alluded to, is that when you look at if it's decision with in joint affiliation with Health Canada and with Transport Canada, to understand if there's any seating arrangement, because it's more of a droplet spread, you have close contact, it's not the whole plane, and there's just a certain number of people around. If you have that, we would probably on the precautionary basis contact those individuals, and that's the key thing. It's not public at large, it's individuals, and it seems, as Dr. Donnelly's alluded to, it's close family contacts. You have to be more than just casually walking by someone in that area there. So it's quite a different one, and we're learning more about it all the time. But anyone who needs to be contacted, it's something that Toronto Public Health feels, even on a more precautionary basis, they will do so and advise them accordingly.
Can you tell us more about how this patient is doing? I know you said stable. What does that mean?
I want to just reiterate the point that Dr. Donnelly made, which is that you know, there's probably a lot of milder forms of this particular infection than what have been reported. I can tell you that this specific patient has presented with the symptoms that are compatible but relatively mild illness, and at the current time is stable. Even as of today, there may have been some early signs of improvement, but we're still monitoring very closely because we know that among the patients that do get worse, that can be after a few days. And so we're still providing active medical care, and the patient has remained in the appropriate precautions since they arrived at Sunnybrook.
Okay, we're going to do the last question.
Can you just describe the person's symptoms a bit more in detail? What exactly, when you say feeling sick, what was he doing?
So the main symptoms that are part of the case definition are respiratory symptoms like cough and also fever, and those would be the symptoms that we are screening all patients for when they arrive at a hospital. And by that is our usual practice during viral respiratory season to have those patients immediately placed in the appropriate precautions. And then we also elicit the travel history on every patient on presentation throughout our organization, and that allows us to identify patients who potentially could be at risk, and they are placed under investigation in the appropriate precautions in that case, and that's what happened in this instance.
So other than cough and fever, was there anything else that led this man to go to the hospital?
We know from the literature that is emerging and what we've learned about this virus over the last month that there can be some other symptoms, but those are the primary symptoms.
So I'm asking about this specific patient. Is there anything else you can tell us?
That's what I can tell you for now, and that their symptoms are fairly mild and they're in stable condition.
And a basic one, presumptive positive. What does that really mean?
I'll make a comment and then let you follow me up. I think it's important to note that the individual, having seen information, knowing his responsibility when feeling well, even with not having really severe symptoms, was concerned enough and informed properly enough. That just tells you that the people have knowledge of it. They want to take the proper precautions. They want to protect they want their health, protect their family members and others. And this individual did that, and that was an excellent one. I'll ask Dr. Donnelly to comment on the representative.
And then we'll wrap things up.
Yeah, I appreciate that the terminology probably sounds a bit complicated. Look, essentially what happened was that Public Health Ontario developed a specific, accurate and rapid test for this disease. And our colleagues at NML in Winnipeg have done the same. They do a slightly different test, but we collaborate with them and we collaborate with other major laboratories in Canada so that this is very much a national effort. And what we've agreed is that because we know our test is rapid and reliable, that we can actually make a positive result from one of our tests actionable. So in other words, we don't wait. But it's good practice still, of course, to also run the test at NML, and they will be doing that. And when theirs comes back positive, as I am very confident it will be, then we move from a presumptive positive to a confirmed case. But I'm sure you spot the value of having a local test. What it means is that it gets us probably 36, 48 hours of a jump on this, so that we know where we stand, and so that Eileen and our colleagues can get onto this and start tracking down contacts early. So that's the value of having a local public health lab that can actually develop this test.
Thanks, everyone.
Iris and one microphone that will
Hi, how are you?
Travis?
Yeah.
Can I?
Yeah. Siobhan, can you just talk? Would it be possible to line up an interview with
Oh my God.
online?
Can I get my phone out?
Yeah, can I get